Pfizer plans to meet with federal health officials as soon as today to discuss the need for a third dose of its COVID-19 vaccine.
Now, the company announced last week it believed a booster shot would be beneficial 6 to 12 months after a vaccination in light of the highly transmissible Delta variant.
12 News reporter Alexander Leslie joins us now. Alex, what are the FDA and CDC saying about Pfizer's recommendation?
Well, both said that Americans who are fully vaccinated did not need a booster at this time, but that health agencies are engaged in a science-based, rigorous process to consider whether or when a booster might be necessary. Dr. Anthony Fauci, who's President Joe Biden's chief medical advisor, is invited to this meeting. Now, appearing on several news programs yesterday, Fauci said given more than 90% of new COVID-related hospitalizations were in unvaccinated patients, that boosters were not recommended right now, but he didn't rule out the possibility they might eventually be needed for certain populations, like people of a certain age or with underlying health conditions. For now, Fauci said additional studies were necessary.
What the pharmaceutical company Pfizer did, they did their own study and said, you know, we think you're going to need a booster, so we're preparing to boost. That's fine. We want companies, we want academic institutions, and we want the government to continue to collect data. So it really is a question of a firm recommendation versus an opinion.
Now, Israel recently announced that it would begin offering a third dose of Pfizer's vaccine to people with weak immune systems, but the country is still considering whether the booster will be made available to the general public. Live in studio, Alexandra Leslie, 12 News.